Kelly Clark is Marketing and Communication Specialist with Titusville Area Hospital. She joins us this morning along with Dr. Charley Gates. Good morning. Good to see you guys this morning.
Good to see you, Luke. Hi.
Hi. Boy, there's so much going on, and it's just March, you know. It's a busy year ahead. Looking forward to a lot of great things. You got some big events coming up. Dr. Gates, you've been so busy with your practice, and never a dull moment. Always something changing or growing, and we're going to get into that here in just a few moments. But Kelly, let's start with some things that are coming up for the hospital.
Yeah, so our big fundraising event for the foundation is our annual golf scramble. That's happening on May 21st, and we already have 15 teams.
Wow.
Yeah, so we can only take so many teams. We can only fit so many in, unfortunately. So if you're looking to put a team in, definitely send in your registration. We also have quite a few sponsors already, so thank you to everyone that has already sponsored. We're always looking for new sponsors, so even if you have a raffle basket or a raffle item you'd like to donate to the cause, absolutely feel free to do that. You can call my office. We can come pick it up for you, however you want to donate.
Sign up. I know last year you had some teams that wanted to play, but you were pretty full.
We were. I think we had to turn away 3 teams maybe.
That's great. Well, it's not great, but it is great.
Yeah, it's great to have a popular event. Unfortunately, you know, you do have to turn some teams away. So this year, I feel like all the teams that I had to turn away are already registered.
Wow.
So definitely get your registration in early. The deadline is May 1, I believe, but it's probably going to close prior to May 1. Sponsorships we will take up until, I think, the day of. You know, that's really the main point of this, is to do fundraising, have some fun, get out there, and enjoy spring, which is coming quickly. Yeah,
raise money for a great cause. You know, every year it seems like you pick some great projects. And really, though, everybody has such a great time. They know that the money is going to be used for great things, so they don't even ask probably. But this year, what's the project?
So this year, our outpatient therapy expansion project, that will be starting actually soon and will wrap up pretty quickly. We're hoping to have it done by the end of December.
Wow.
So what that is our current outpatient physical therapy office. We're expanding that to include speech therapy and also occupational therapy. We're adding a couple more items for the occupational therapy to use for their services. One of them is a pediatric sensory room. So that's really exciting. It's the first in the area, in our service area right here. So for, you know, families that need those services, they're going to be really close to home, and it's definitely a need in the area. So we're really excited to add that.
That's great. Well, speaking of therapy, real quick, Dr. Gates, you spent some time with the physical therapy staff, and that's a great picture. Looks like you were with some trouble there, but you know.
Yeah, I did. It was a great visit. We had some Subway lunch, and it was great to see the team again face to face, because really we are mutually dependent on each other for our success of our patients. I'm a big believer in physical therapy, both before and after surgery. Physical therapy is one of the key levers that I pull to try to avoid surgery. I mean, a lot of people have not put in the time and effort to work on themselves, and therapy helps them do that. And almost everyone does better with somebody watching you and coaching you, and that's what the therapists do. And then, of course, after surgery, my role is 2 hours in the operating room, but after that, it's up to the patient and the therapist to work together to rehabilitate that joint that I worked on. And so a key relationship, and I had a great visit with the team, and I'm excited for the expansion because it's really going to, I think, benefit our orthopedic patients.
That's great. And I noticed you said team in there quite a bit. It really is. It's important for what you do and for the patient as well. So it's an overall concern for the patient. It's from the, you know, the start through the end. It seems like the hospital is there for that patient.
It is. I mean, I think at a high level, life is a team sport. You know, and as I get a little bit older, I realize that more and more, that you're as good as the team you have around you. And that's one of the things that I'm enjoying about being in Titusville, is the opportunity to really influence the direction of the orthopedic program, and to build a great team to take great care of the orthopedic patients. And so far we're doing that. And like you said, from the anesthesia team in the operating room to the OR personnel to my office staff, to the therapy team. It's a team, and I'm part of that. I have a big responsibility. I take responsibility for everything that happens in the team, but definitely I'm dependent on other people in a good way, and they have delivered, and I'm confident that they'll continue to deliver as we grow the orthopedic program here.
That's great. And we're going to come back to learn more about what's been going on with your practice. But Kelly, just a couple other things coming up. Big anniversary for the hospital?
Yes. So actually coming very soon. March 26th marks the date in 1900 of when the hospital began.
Wow.
They began the charter for the hospital in 1900, which was 125 years ago. So this year we are definitely celebrating. We have a couple things planned for our staff and for the hospital. We'll definitely have some things out on Facebook about that. But really big year, and like I said, it kicks off March 26th. Marks the actual date. So pretty exciting. I mean, I've done a lot of research leading up to this about the hospital, and just so many interesting facts and how it got started and what it has become from start to now, and looking at these, I know I talk about a lot of different projects, but, just being able to see the projects that they did, over the past 125 years is really amazing.
Yeah, that'd be incredible to look back at that history.
Oh, it is. So many really amazing pictures. A lot of the people before me have done scrapbooks and photo albums, and just so much really great history has been kept in the hospital.
That's great. And what's fascinating is you've had access to Larry Flutterman and Steve Coleman, who were alive back then, to talk about that. Yeah, that's allergy testing.
Yeah, so I had Dr. Paneru on the show with me last month. She is our new ENT doctor at the hospital. She is now offering allergy testing in her hospital, which is something new that we haven't offered before. It is the skin prick test. So if you're having issues with seasonal allergies, runny nose, coughing, skin irritations, things like that, you can have allergy testing done right in her office here. So something new. The staff has been, really working on getting this done, because they see so many instances where, that's a necessity. So, yeah, exciting to offer that now, and I'm sure it's going to be very busy.
All right, fantastic. Yeah, there's a lot going on, and Facebook page is a great place to go to get additional information as well.
Yes, so everything new, every service we add, every project we do, we try to share that on Facebook. We also do press releases, things like that within, other avenues in the Titusville News Journal. I was going to call it the Herald. The Titusville News Journal. We usually have all of our new services in there as well.
Career opportunities also posted.
Yes, career opportunities. We have quite a few RN positions for nursing. We're always accepting, new nurses, especially new graduates. It's a really great place to start, since it's a smaller hospital, critical access hospital. We are also hiring nursing supervisors. We have some other clinical positions available. So if you go onto our website, you can go on our website, or our Facebook page also has a lot of those listings available.
That's fantastic. All right,
Yeah.
Go there and check that out. Dr. Gates, catch us up on your practice. You've been pretty busy, not only with your practice, but also inviting the public to come and learn more about what you do. You're also part of OAM, which is a recognized group from Meadville when it comes to orthopedic medicine, and there's just so much going on with your practice. Catch us up with everything that's been happening.
Yeah, sure, Luke, and thanks for the opportunity to come here this morning. And as you mentioned, I'm one of the 5 surgeons of Orthopedic Associates of Meadville. We're a great group. Between the 5 of us, we cover everything, and I am spending most of my time here in Titusville to develop and grow the program here, and that's really a point of pride for me. It's very meaningful to me to be here where there's great need and to serve the community while still being part of a world-class group like Orthopedic Associates of Meadville. I do operate in Meadville also and take call in Meadville, so that's something that I bring to the community here, is those relationships and that connection. And within our practice, I'm in my third year. Time's flying,
Wow.
and going well, and having fun doing what we can to get the word out there. The orthopedic surgeon before me stopped operating for health reasons, and so a lot of behavioral patterns and practice patterns of referrals shifted, and we're working to kind of bring those back and doing some fun things like lunchtime meetings, and now we're doing some coffee talks with the doc in the afternoons on Thursdays. And I started a Facebook page, which I had no social media presence at all, and I don't do much on it, but I do use it as a vehicle to let people know what's going on. And even sitting here listening to Kelly, I learned a couple of things about the hospital that I didn't know, like the 125-year history. I think that's fantastic. Very few institutions have been around for 125 years, and so what a remarkable achievement for the hospital, and proud to be a part of that and try to get us another 125. Yeah.
Well, that's fantastic. And so a couple thoughts here. When you meet with people, I'm sure you offer questions, right? Do you find that people are asking a lot of the same questions about what you do, or do they vary quite a bit?
Yeah, I get a lot of questions repeat themselves because a lot of what I see in orthopedics are similar things. Knee pain, shoulder pain. There's only so many things that can be wrong, and most of the questions that come up are the ones that you'd anticipate and expect. And when I do that, I try to create some information for patients, like on a post or a short video, to kind of answer some of those questions that are anticipated. And for example, for total knee replacements, we've got a packet we give people. Anyone, even whenever the topic comes up at all, we give them this packet. I don't count on the patient to remember what I say during the office, because I think there's good data that people walk out and just don't remember, right? And that same thing happens to me. So we give them, it's all written down. All the questions of, how long will my recovery take? What happens during surgery? What are my options, etc. So we cover it all, and I invite questions, and I pride myself in always asking the patient, do you have any questions for me before I leave the room, to really open the floor and don't end the appointment until they're, till they're satisfied.
Let's do this real quick. You're watching The Morning Drill on Stream TV and on the Armstrong Neighborhood Channel. Kelly Clark and Dr. Charley Gates with us here this morning, Titusville Area Hospital. I hear a lot of people who have gone through the procedure say, I should have done this years ago. And you think back at all the things they've kind of missed out on over the years of dealing with pain, when they could have taken care of it, years prior. What's that first step? If somebody is feeling pain there, or they're not able to do the things they want to do, what would you say to them? Because I would imagine the first step is having a conversation.
Exactly. Come into the office. There's no obligation. Come in, sit down, talk. We have availability. We can see people with short notice, and just come in and have a conversation. Ask what's on your mind. Tell me what's happening. Lots of times the answer is not surgery. Like I said, I'm a conservative surgeon in a good way, and we always explore non-operative routes. And, in that way, I build some relationships with patients, because some of these issues take years. Like knee arthritis is developing over years. And so come in and have a conversation. I've got a terrific assistant, Andrew, physician assistant. He's in his first job out of school, so he's young. In fact, I tell people that people used to comment to me how young I looked until Andrew was hired, and now I look my age because Andrew looks so young. But he's wonderful and does a great job, very knowledgeable, and so having a conversation with either of us is a great first step for any patient that's having pain or has any questions.
How much time do you spend continuing your journey into your practice, when it comes to techniques or equipment that you want to incorporate in the office? And I understand ultrasound is now part of the practice.
I spend a lot of time doing that, and I think probably I'm an outlier with regards to that. I think most surgeons, when they're done, they've had 10 years of training, and that's it. They're tired, and they just kind of go into practice, and that's what they do. No problem. It's very hard to get surgeons to change what they're doing, because that's what they do. I love learning. I really do. I'm a curious person by nature. I consider myself an amateur historian and read a lot. And in orthopedics, it's the same way. And you mentioned ultrasound, and that's something that we've brought online here in the last couple of months. It's a great tool. It's been around for a long time. It's got a lot of benefits in that, number one, it's completely safe. There's no radiation. It's based on sound waves. Number two, it can be done immediately right there in the office without any delay. Number three, it allows for dynamic imaging, meaning that the patient can move their joint while I'm watching what's happening. It's impossible.
Oh, wow.
It's impossible to do with MRI or X-ray. So I can be very specific with where it hurts, what's happening, and they can show me, and we can look at what's happening with the muscle and the tendon. It's great. And then also, of course, it's much less expensive than other imaging modalities. And another big benefit is you can do procedures with it. So you can inject using the image to guide me, which is very powerful. I've done thousands of injections. I honestly don't feel that I need it, but it's good to do it, to be able to show the patient, look here's where I am. You know, you don't have to take my word for it. Here's the image. Pictures 1,000 words, pictures don't lie type thing. So ultrasound's great, and happy to have that available here. I don't know of any other orthopedic surgeon in Northwest Pennsylvania who's doing ultrasound in the office like we are here in Titusville.
Wow. What if a patient starts experiencing what? Kind of go through those symptoms. Like if you start to feel this or this, maybe it's time to call.
Yeah, I mean, I think pain is a great example. If you're having pain with activities that's not going away, in the shoulder, that tends to be overhead and reaching activities are the exercises that are hardest for people. In the knee and hip, you're having problems like maybe walking up steps or walking for long distances. But if you're having pain, I mean, that's people who see me are in pain. I mean, that's usually, no one sees the orthopedic for prevention. I wish they did. I believe in prevention. You know, stitch in time saves 9, like we all learned as a child, is really true. But if you're having pain or anything that you can't do that you want to do, come on in and have a conversation.
We had a pretty rough winter. We actually had a winter. So I know there's, people sliding around out there and probably in some discomfort, especially now that the weather's breaking, people are getting out and maybe going for walks. Or they're going to be, I keep thinking of people working in their gardens and, that up and down motion and just that harshness on your knees. If you're experiencing any discomfort there, a call to the doctor is probably a good thing. Even if it's just a minor thing, it's something you can jump on now, and maybe it's something where you say, yeah, physical therapy, or you know what, this might be a problem in the next year or two. Let's keep an eye on this. But at least that conversation gets things started.
Exactly. Come on in and have a conversation. On my way here today to the station, I passed some landscapers who are doing some mulching, and I thought, man, spring's really here when you see the mulch coming out. So yeah, people get more active. It was a tough winter and took care of a lot of fractures, a lot of unfortunate breaks of hip, wrist, and ankle, but we take care of that right here. In fact, a couple of times, patients who are on the launching pad to be transferred from Titusville, and we were able to keep those patients here, and they were so happy to be able to have their orthopedic care right here in Titusville. They're spared a painful ambulance ride with the fracture. Family can visit them easily, and was very happy to be able to do that. Yeah.
I keep thinking, too, that golfers, they want to get out there and play, and they want to make sure they're okay. But the other sport that's really growing is pickleball. So I don't know if you've seen any injuries from that, or if you're anticipating seeing some of those patients down the road.
I do see a lot of pickleball injuries.
And they want to know, Doc, when can I get back out there and play?
They do. And yeah, pickleball is a passion for a lot of people, and I'm a fan of exercise in any form. And if you like something, do it. I see a lot of runners, but if they love it, do it. Do what's meaningful to you, and we'll do our best to keep you doing the things that are meaningful to you as long as you can.
Are patients surprised at the recovery process? And even, again, just looking at the history of 125 years, a lot has changed. A lot has changed in your practice probably in the last 5 years. I mean, technology is incredible, and the recovery times seem like people would be surprised at sort of the turnaround when they're able to get back out to enjoy those things?
Yeah, for sure. You know, I think I had a knee surgery, a ligament knee surgery when I was in high school, and spent 2 nights as an inpatient in the hospital after surgery. And today I'm doing total knee replacements and people are going home the next day.
Wow.
So yeah, it's really a revolution of shorter care times and enhanced recovery. And it has to do with the team approach that we talked about earlier. Getting therapy involved sooner, coaching the patient before about what to expect, optimizing with the pharmacy team, all of the medications afterwards. We minimize narcotics, a lot of anti-inflammatories, attack that pain scheme through lots of different points to keep people off of the heavy-hitting medicines that have side effects. And so all of that combined really has quickened recoveries. It's really great.
Dr. Gates, Kelly Clark, good to see you this morning. Kelly, folks have questions. How do they get a hold of you?
Yeah, if folks have questions, you can call Dr. Gates' office to schedule any appointments, 814-827-9770. You can also call the foundation office if you have any questions or would like to sponsor golf. You can call that office at 814-827-1060. And I'd like to add, Dr. Gates has another Coffee Talk with the Doc coming up on May 8th. That will be his next one at 2 o'clock, right?
May 8th. All right. And then for folks watching in Meadville, they can contact OAM?
Yes.
Okay.
So they can contact OAM, and depends on which office that you'd like to be seen in, but
Okay.
absolutely.
Good to see you. Thank you.
Thank you, Luke.
Good to see you.